Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Kristina Ryan, who's the pharmacist at Baptist Health Lexington. Welcome.
Thank you.
Now, Baptist Health is new. They got the emergency room and some observation beds there. And you're the pharmacist there, and we know pharmacists do all it in-house at the Baptist at Hamburg and Lexington. Mm-hmm. But you also do some what I'm going to call retail. That's pretty new?
Yes. So retail is also known as community pharmacy. Baptist Health Lexington has both the main campus on Nicholasville Road and the new facility at Hamburg. Our pharmacy is open to the public. We are conveniently located. We do have curbside pickup as an alternative to drive-through. We do 90-day refills for eligible patients. We can sync up medications for one-day pickup. We offer vaccines like your flu shot or COVID, as well as additional ones. You can always call us if you want to ask about a specific vaccine. We also collaborate with your providers to get refills or prior authorizations for insurance, as well as medication therapy management, which basically looks at the whole profile of the patient, all of the medications, checking for interactions, how they take their medicine, just looking for anything that maybe could be changed or adjusted to better suit the patient.
Now you mentioned you collaborate with their provider.
Yes.
Well, you mentioned a lot of stuff that pharmacists do, and we'll kind of talk about that a little bit. Collaboration with their provider. Mm-hmm. If they want their prescription filled, they need to tell the provider, send it to Baptist in Hamburg.
Absolutely. And if their prescriptions are at another pharmacy currently, we can transfer prescriptions very easily. You just give us a call, we will contact your pharmacy and then transfer those prescriptions. So either way, we can get those directly from the doctor or also from the other pharmacy.
I heard you say curbside pickup too.
Yes, curbside is really nice, especially in these cold temps. Unfortunately, the facility doesn't offer drive-through, but we do offer that service for patients that have trouble coming in or just have physical challenges that make it difficult.
Now, you mentioned some things in terms of what pharmacists do. There's a lot of people who don't take their medication or don't take it right, or for that matter, don't even get it filled.
Yes.
Are there some reasons for that or some ways pharmacists can intervene?
Yes, I'm glad you asked that. So if adherence is so important, and there's a lot of barriers to that that people may not realize. The first would be cost. If the medicine's too expensive, the patient either will not take it at all or they may not take it the way they're supposed to. Also, it depends on if the patient knows why they're taking their medicine. If it's for something like cholesterol or blood pressure and the patient isn't aware of what the medicine is for, that's not going to help them long term. And
if they, blood pressure and cholesterol, that doesn't hurt, it won't kill you, so why am I taking a pill?
Right. Blood pressure is known, or high blood pressure is known as a silent killer because people they can't always feel that their blood pressure is high. So it's important that there is no barrier to the patient for taking that medicine that's so important. Also, another barrier could be how often they take it or when they take it. Trying to fit that into their schedule can be challenging, especially if they're having to take it multiple times a day. So we really try to work with patients on helping them with that. And then just side effects, like patients are worried, what is this going to do? What kind of effects will it have on my daily life? And so we, as pharmacists, we just want to make it easier for patients to understand what they're taking, why they're taking it, and how it's going to affect their long-term health.
And also things like, okay, I missed a dose, do I need to take it?
Right.
Do I need to refrigerate it? How to keep the medicine?
Absolutely.
Expiration of the medicine? Those are all kinds of things pharmacists do.
Absolutely. When a patient is given a new prescription, we always offer counsel in case they have questions about that, whatever questions they are. Sometimes when they're in the office with the provider, they don't always get all of their questions answered, so we try to be a resource, especially for medications and what can happen with taking them.
And people can ask their pharmacist about questions about the medicine, whatever they may be, and they can also ask the pharmacist for help with maybe choosing an over-the-counter medicine?
Absolutely. Sometimes when you get to the over-the-counter section of a pharmacy, it looks very overwhelming to people. So we just try to, anyone can come in, ask us a question, and if it's something that we can't answer, we'll always refer them to their provider. But it's also something that's not realized is a lot of over-the-counter medicines aren't regulated by the FDA. And so we always want to make sure that patients are talking with their provider, talking with their pharmacist, making sure they're getting more information about an over-the-counter item before just taking it.
Well, we appreciate all the information. We appreciate you coming in.
Thank you.
And you may want to access the new community pharmacy at Baptist Hamburg. We'll be right back.